Well, I'll start recording. Have your permission for all this?
Sure.
Good. All right. So, let's see. Good opening question would be, well, what brought you in? How long have you been struggling with some back pain? Tell us about it.
Sure. My name is Bama Katavi, and I've been suffering from back pain for about 30 years or so. And of course, I was very hesitant to getting any kind of surgery done. Going back to my background, coming from a very precision industry, which is the nuclear power plant, everything has to be precise, and everything has to be calculated, and risk has to be known to me as well. So I was very hesitant to have this surgery done. But luckily, I came to know Dr. Abbasi through a good friend of mine, Dr. Orandi, who is a radiologist. I think he worked with Dr. Abbasi very closely in the past. So I asked him a lot of questions, but one of the questions I asked him was, what is the failure rate of the procedures that he has performed in the past? And it didn't take him long at all to convince me that. He said, look, I get to look at a lot of post MRIs or CTs, and he very convincingly told me 0. He said, I have not seen any. So that kind of got my attention. Even in a nuclear power plant, we don't have a 0 failure rate. There is a failure rate. Very, very small, but there's a failure rate. So that kind of got my attention. And I started looking him up, and the more research I did, the more impressed I got. Till actually we came here. I have to say that even now, I'm much more impressed by total experience that we have actually gained. Not only in the operating room, I don't remember anything, I was completely out, but however, just the first glance at it, everything was very professional, very, staff were very, very professional, everything state of art. And come to find out that Dr. Abbasi also has a PhD in computer science. Now explains a lot of things, how he could make this thing so precise, and everything, the whole process is so precise. So my experience from get-go, from basically coming here and meeting some of the staff, which you could tell that they don't do this just for paycheck. They have a passion to basically help people. It's not just here's another patient. So from his professionalism, I don't know how many times he checked on me. My whole experience has been very positive. I'm hoping that my nerves will cooperate and get better soon. Of course, it's only been about 5 days. Again, I don't know if I've mentioned or not, we flew here from California, and we're going back in another 2 hours, going back to California. And I'm actually amazed at how much improvement I've made in the last 4 or 5 days. So, to make it short, I highly recommend Dr. Abbasi to anybody. In fact, I will campaign for him when I get to California, because I know a whole bunch of people who are suffering from the same thing, but they're just like me. They're afraid of the surgery.
You've done beautiful there. I actually only have one question, and this is one of the biggest reasons why we're able to grow so well and do the things that we do. Is a lot of the times we not only look at the good things we do, but anything we've done poorly or like just the negative effects of things. So out of this whole experience, what has been the worst part?
I don't know if there's a worst part, really. But again, coming from a certain background in industry, time is very important to me. Waiting, it's not my thing. Against me, a lot of people don't care. They'll sit there for half an hour and wait. But I think the only improvement that I would say that possibly could, again, he's a physician, you don't know what complication a patient may have, so instead of 10-15 minutes, it may take half an hour. The only thing that I would recommend is perhaps working on the timing a little bit, that's all.
Okay. Wonderful.